Sorry guys, I'm trying to share my screen here. Can you see the screen in a presentation mode?
Yes, we can, Dr. Balaji.
Okay, thank you. Hey guys, before we get started on a grand round talk, I have a quick announcement to make. We did have an incident in our department, which was totally unintentional and accidental with regard to a privacy concern. And this is related to accessing EMR. So the privacy office has asked me as a chair of the department to communicate this to the entire department, and I think this is a good forum to do so. That please be aware of our privacy policies when we related to EMR. We are not allowed to access our own records, our colleagues, or anybody's record unless we have a professional relationship with the patient. So please be mindful of this, and there are strict policies in this regard. Okay. I just want you guys to be aware of it, and I've been asked to communicate this to all of you. Good. So the topic for today is laying a foundation for a competitive CV, and and this is really geared towards residents, fellows, and really junior faculty. But we could use this for faculty at any level. And I'm just going to go through some of the things that might be helpful for us to get started early. So you will find this habit very valuable.
Casey, can I just interrupt real quick? And I
Yes.
apologize,
Yeah,
but
no, sure.
could you happen to introduce Virginia Williams?
Thank you, Joe. Guys, we have Virginia Williams with us. She's our GME coordinator. And Virginia, welcome to Urology. We are really delighted that you're here. And Virginia will be, her primary role would be with our residency program, and she'll be working with Dr. Costa. She'll also help Dr. Marino with medical student clerkship affairs. She'll be working with me with regard to the fellowship program, as well as the research associates program. And she's really here to help us with the with our educational mission of our department. And Virginia, would you like to say a few words if you prefer?
I just want to say hi, guys. Nice to meet you all.
So, guys, Virginia, yeah, residents, RAs, fellows, med students, she is your resource to go to. Virginia's in the Cubbies in the office next to near Shelby. And it's God, I've missed having somebody like her. So I think this is going to be great beginnings of a wonderful support staff. And so, Virginia, welcome. And thanks so much, Casey, for taking a minute.
Yeah, you're welcome. Thank you for reminding me, Joe. Appreciate it. And welcome, Virginia. We're glad to have you with us. Okay. So, guys, as you're all aware, our department is more different in terms of our grand rounds. In addition to using them for urology content, we also do a lot of system-based talks, invited professors, and all that. And I really enjoy doing this Humans in Medicine series for the last few years. My understanding is, we take care of humans, but we are humans ourselves, so we need to take care of ourselves. And wellness has become in the forefront now. We are talking about how we should be well to be able to take care of others. And with that in mind, I've tried to put a few talks together over the years, and it's more a reflection for me as much as anything else. And today I thought of laying the talk about CV because we are professionals and we need to be able to market ourselves, and I'll talk to you what CV is all about and so on. So this is again on the same theme. We need to do well for ourselves before we can help others, and it's very important. Okay. Again, a lot of these talks are available on our server. If any of you are interested, let me know. I'm happy to share with you guys. Okay. So coming back to building a competitive CV, and this is, if there's one message I want you guys to remember today, is this: Rome wasn't built in a day, but they worked on it every day. As I was thinking about this, I was thinking of our residents and who graduated, and I reflected back on the days I interviewed them, and these are very, very bright and brilliant people. These are aspiring medical students who really wanted to become independent practitioners in urology, and in 5 years they're really transformed professionally from being a medical student to somebody who's going to who practice independently, who can take care of other people, and other people trust their lives with them. And that transformation is not didn't happen overnight. It's because what residents do every day. You guys show up to work, you work really hard, and you work hard every day. And the change that happens in you and in your skill sets, it's incremental. But at the end of the day, you're transformed yourself from an aspiring urologist, from a smart medical student, to an independent urologist. And that to me is a classic example of this, that Rome wasn't built in a day, but they worked on it every day. And I'm only using that analogy to remind you and to stress that building a competitive CV is exactly the same thing. Anything you do in your professional life should be geared towards getting it on your CV, and that way, and this CV will help you to go places and wherever you choose to go. And that's why this is important. Unfortunately, this is often neglected. We do what we do, and suddenly an opportunity comes up, or there is a new role in your organization, and you're aspiring for it, and they say, hey, why don't you send me your CV or your resume? And now we're going back and trying to figure out, oh, last 3 years, what have I done and how do I do it? And then those are missed opportunities. So for residents and fellows, if you can start thinking about it right now and then start this process now, and I will teach you a lot of tools you can use to be successful in this endeavor, and you're going to be very happy that you did this. Again, it doesn't take a whole lot of time. It just takes some commitment. That's all. So before we get started on a curriculum vitae, there are two words that are used often interchangeably, the resume and curriculum vitae. Just resume is usually, there is in this country, these things are used pretty separately. But some of the other countries in Europe and other areas, they are used pretty interchangeably. But because most of us practice in this country, it's important for us to know the difference. The resume is a brief summary of your qualification, skills, and experience. So it's usually 1 or 2 pages. More often than not, it's one-page resume. It focuses on specific job category or industry. In medicine, we tend to use medicine and science-related professions. We generally use curriculum vitae, whereas in a lot of other corporate sectors and so on, it's usually more a resume. Resume really highlights the most relevant information, is very, very concise. The other thing about the resume is very direct. It tells people, look, this is what my skills are, and this is what I've done. There's not a whole lot of room for inference. Curriculum vitae, on the other hand, is very detailed overview of academic and professional background. And again, healthcare and science generally fall into this category. This can go several pages in length, and sometimes this can be more like a book than it's a very long document. Especially higher up you go in your ladder, you quickly recognize that you need ways to navigate this document, because these can get very, very long, but also necessary, because there's a lot of details in it. And higher you go, you're looking at more competitive positions. So your competition is intense, and you need to be able to distinguish yourself from your competition. It covers a very broad range of information achievements, and we'll go through a sample document here so that you guys understand what this is about. It has to provide very comprehensive detail of your career, because especially as you go up in your career, and if you're looking at leadership positions and so on, there are people critically reviewing your CV, and they want to know your trajectory, your direction, your vision, and so on and so forth. And we need to be able to communicate that through your CV. And it'll have multiple sections, and I will talk about it again: education, research, publications, and more. And as we already mentioned, it's often used in academic research and scientific positions. Any questions or comments on the difference between resume and curriculum vitae at this point? Okay, guys, feel free to interject, and if you have any questions or comments, you're always welcome to make it. Okay. Now, for everything, what is the purpose? I mean, why is it so important to start building CV very early on in your career and keep it current? Remember, this is a key instrument. Think of it like a tool in the OR, or a computer that we use to do our work. This is vital, because as you progress in your career, then we all look for new jobs. We all look for new roles in our positions we are in. And that's why we want to, growth should never stop. We want to continue growing. And when we do that, then when we seek these opportunities, then people are going to ask us, okay, would you mind sending me your resume? Would you mind sending me your CV? And this becomes a key instrument. So think of it like an instrument, and that's why it's so important. Like we know, if you're using a robot, you want the best instrument to do it. If you're using a knife to cut, you want the sharpest knife to cut. It's the same thing. So keep it sharp, and that's why this is so important. And the other thing is, we all know we live in a very complex world. When we apply for a job, we send our CV in, and then this is a small world. People talk to each other. And then what happens is, this is your chance to introduce yourself for this role. It could be a new job or a new role in your institution, or whatever your goal is. Your CV is your call. So you mention in your CV the way you want the world to see you and your professional life, or your potential in the future. Whereas a lot of things that happen around you, they're going to call a old friend who had worked with you. And then a lot of decisions are made based on perception, based on what other people tell of you. So, and a lot of them, I'm sure, is very favorable, but you can't please everybody in your life. So they're also going to hear things that may not be the most favorable. And then your CV is your best defense. So a fair judge would be able to corroborate that, and then make a fair judgment on your behalf. So the CV is your call. This is one time where you get to tell them who you are and what you think you are. And that's why it's so important. And humans evolved to communicate. And there are so many ways we communicate with each other. The most enduring way to communicate, and perhaps the most powerful way to communicate, is in writing, because this lasts long after we are gone. And we can do this remotely. We don't get access to talk to somebody all the time, or reach out to somebody, or meet in person. Communication writing is one of the key skills that's important. And the CV allows us to do that. So even before they get to see you, know you, meet you, your CV speaks on your behalf. And that's why this is such a powerful communication writing, and we need to be able to do this very well. We also live in a very competitive world, and also not only competition in quality, but also competition in quantity. Just think about this now. We have one residency spot here, and Dr. Coster gets over 400 applications for that one spot. Some years, last year, I think we got over 250 spots. And you can look at it from a program director's perspective. How do you distinguish between these extraordinarily qualified applicants who look very, very similar? So distinguishing them, and at the end of the day, discriminating between the greatest, the best of the best, is not easy. So this CV should help to do that, so that you get noticed. There's something special, there's something unique in you that distinguishes you from others. And the big goal for all these resumes and CVs is to really move to the next step, and whatever that next step might be. For example, if you're applying for a job, the next step would be you want to get a call from your future employer. You want to be invited for an interview, and your curriculum vitae should be impressive enough that it takes you to the next step. And of course, one has to perform well in an interview, and then we have to see whether that's a right fit or not. And I'm just using the next job as an example. You don't have to move jobs to update or send your resume. It could be within your organization. You could be in private practice. Now you want to take on additional roles, or they're looking for a leader on your group who wants to lead, or your group merges with another group, and then they're looking for leaders. There are so many roles we all can play, even within the organization we are in, that your resume, your curriculum vitae should be able to do that. Just move you to the next step. And then your curriculum vitae should stand out. And I'll show you some examples of how you could do that. You don't have to do anything special. It's the way you craft and present it is what's important. And I'll also talks about tips and traps of building a competitive CV in a moment. But your whole goal is to stand out. And ultimately, you want to beat your competition. We are competitive people. You're in this race to win, and you want to win, and you should win. And a CV is the instrument that gets you started on this path, and you want to succeed in whatever your goals are. And we want winners, okay? And you should be the winner, and there's no reason you shouldn't be, because you worked hard to get where you are. All that you're now doing is documenting all that in a way that it gets noticed, it stands out from other people, gets you to the next step, it beats your competition, and you succeed. Okay, and that's why it's so important to build this CV. Now, as you work towards your CV, I want to highlight some of the tips and traps that can exist when you build a CV. Now, the tips are very important. Should always be truthful. Okay, there cannot be any lies on your CV, because if there is a lie and that's discovered, then the credibility is in question, and so we have to be very careful. We also want to be transparent. Put your CV, anything and everything you have done, and that way it's very clear to people what the trajectory of your career is. Be very thorough. Gaps are generally not a good thing, or if there is a gap, we need to explain that. I took a couple of years to hike the operation, whatever you did, but that's okay as long as we can explain it. Now, it has to stay current. And I tell you, over the years, I've had the pleasure and privilege of reviewing hundreds of resumes and curriculum vitae for several jobs, for every level of healthcare up to CEOs. I have served as chair of search committees for chairs, and so on and so forth. And occasionally, I have come across CVs that are not current. You could see that it hasn't been updated in 2 or 3 years. The person in a rush sent either an older version, or they just didn't care to update it. So, those things may not reflect favorably. And therefore, it's important to keep it current. And I'm going to walk you through some of the tools, how to make sure it's current. It has to be clear, organized, and verifiable. And I'll also show you some examples. It's simple. Give you an example. We have residency applicants coming in, And then we have the way our ERAS application is set up. It doesn't allow the applicants to distinguish clearly between whether their publication is an abstract or a manuscript. It's just hard. So when I look at ERAS applications, and and Dr. Costa and I have to go through hundreds of them, and we don't have a whole lot of time. Within a couple of weeks, in midst of our busy schedule, we have to go through this application. So I'm going through these applications. I don't know whether this is an abstract or a publication. If there is a PMID next to it, it's helpful to me. So that tells me two things. First, I know it's cited in PubMed, and then there's a PMID, and therefore I can quickly put the number in and I can verify it. So having verifiable information improves credibility. And these days, there are multiple sources, and also show you some examples how your curriculum should be verifiable. If there are hyperlinks available, put them on your curriculum vitae so people can easily click on that hyperlink and verify what you have just stated. And the important thing is you need to know your audience, type of job you're applying for, type of positions you're applying for, and you need to try and tailor it as much as you can for that particular position. So one size may not fit all, and you need to be careful what you're applying for. It just takes a little bit of time, but if you had worked on your CV all along consistently, it should not take too much time. But if you haven't done it, then you got to invest some time and get up to speed. From there on, try and keep it as current as possible. The other thing that's evolving now is AI. So if we look at large recruitment platforms like Indeed and so on, they are using AI now to screen applications. So even to get to the next level, these are screened automatically before it's promoted. And there was in the news now, Google is using AI to interview people. So that period is changing. So my feeling is even before we get to meet a person in an interview, sooner or later, these processes are going to kick in. And so as you prepare your CV, we need to understand how generative AI works and how these AIs recognize the CVs and what they are for. And we did have our talk on generative AI the other day, so that we have some idea what machine learning is all about and what deep learning is. So having some conceptual idea of how these things work would also be helpful. So as you prepare your CV, just make sure this is AI ready and this is the future. Okay. As you're trying to do all this, please remember some of the traps. And I have pretty much seen some of these in variety of resumes and CVs I have seen over the years. Okay, you don't want to look stale. The way I ask myself, and when I review CVs, I ask the same question: what have I done in the last 5 years that I've not done in the previous 5 years? So if I'm doing the same thing and there's really nothing new to add in the last 5 years, I've become a little bit stale. I need to kind of get some energy and enthusiasm back and try and do something different, something better. And so you don't want your CV to look stale. You want it to look exciting. You don't want it to be old. We also talked about staying current. Clarity is important. Now with all the new AI tools and all that, this will help us to build, articulate it well and so on. It shouldn't be disordered. Don't put anything in there that is not true, because if we are found out, then credibility is an issue. Most of the time at our level, put in what you do, but make sure you put in everything that you do. So we don't really need padding. We don't need to sell ourselves. Your CV, your accomplishment will sell for itself. And don't pad it. Avoid typos. And with AI and all that, they should be few and far between. Do not have an incomplete CV. Have a thorough structure. And gaps. Gaps do happen in our careers for one reason or the other. Please explain that, why, and that's all it takes. Okay. Any questions on tips and traps of building a curriculum vitae?
Dr. Balaji, one
Yeah.
quick question.
Yeah.
So with somebody who has a very high volume of publications, whether it's papers, abstracts, conferences, etc., would you list every single publication? And let's say we're talking about somebody who has like 100 publications. Would you list every single publication, or you'd probably just like include like a link to your Google Scholar account or something like that?
Yeah, I would do both, Mo. And I'll show an example. Yeah, I would do both because your CV has to contain everything. Like if you have an abstract and you have 10 authors in that abstract, you need to put all the 10 authors in, because it tells me something. For example, when I review CVs, and especially I do this for senior faculty position, chair, or CEO positions, is I want to look for two things. First is I want to see leadership. How many publications is this person the first author? I think that's important. And the second thing is, how many publications is this person a co-author? It tells me two important qualities I look for in a person. First is, can this person lead a project? More importantly, can this be a collaborator? In other words, can this person take another person take a lead and still work with them? And so I look for a right mixture. And without putting in all those details, it'll be hard for me to make that judgment. If somebody is all just collaborator and never is not, or very few publications lead author, that's a red flag to me. And the other thing is, if they are only lead authors, but not a whole lot of collaboration, then that's a point I would have to discuss with them, why. And the third thing is the ratio to abstracts and publication is important because, in a job, there are a lot of people who take on a lot of responsibilities, but they may not take it to completion. And that is a problem for teamwork. I can deal with people who can say, no, I can't do this now. I'm sorry, I'm busy. I think I can deal with that. But somebody who says yes, but doesn't take it to completion, it affects teamwork. And that's a little bit of a risk. And so if I look at the number of abstracts and if I look at the number of publications, and then if they have taken most of their abstracts to publication, that in my mind bodes very well. That means this person not only starts, but able to complete it. For those reasons, Mo, I would keep it as exhaustive as possible.
Thank you, sir. Yes, sir.
Yeah, thank you, Mo. And the good thing about a CV, there's no page limit. Okay, so longer it is, as long as it's meaningful and purposeful, and you can see a direction to it, I think it's great. Again, the theme is, you have already done the work. You presented the abstract, put it in and in there. That way, you're competing with some extraordinarily bright and accomplished people in the field, and you want to win this game. Any other questions on the tips and traps? Okay, so what are the tools? And again, I will show you guys some examples as we go through it. But this is kind of what I generally use. First is build on a structure. There are a variety of samples out there that you can source or can get from one of our colleagues or people. You're surrounded with people who are very successful. So reach out to them. Hey, would you mind sharing your CV? Can I look at your structure? And I think that's reasonable. And the key thing is stay current. So initially, you're going to invest some time building the structure. Then updating it shouldn't take you that much time, but you need to be committed to updating it. And it could be whatever frequency you choose to do, or it could be event driven. You add an abstract accepted to your to a presentation, or you just recently had a manuscript accepted or published. That may be a time. Or if nothing happened for 3 months, maybe you can look at it every 3 months and just make sure it stays current. And I would strongly encourage you guys to update at every opportunity. This becomes very, very important because I have seen this often. Over the years, I worked in multiple academic institutions. People come up for promotions and so on. And now they want to go off for promotion. Now they're looking back at the CV. Now, because it hasn't been updated regularly, there are a lot of missed opportunities. They might have served in a national committee or a regional committee, or they would have given a talk at a grand rounds. It's just that they hadn't made a note of it. It's very hard to recall at that point. And now you already done the work. and you're regionally and nationally recognized for what you do. And that's what promotion is all about. And now you haven't had a chance to put it in, or if you're putting it in, you're scrambling back. Okay. And the reason I'm really talking to our residents and fellows about this is it's so important that you get started right now. That way, you don't have to scramble for it when the time comes. You're all ready. And then there's a moment, and you could also periodically look at your own CV, review and reflect it, because what we are today, we may not be 5 years from now professionally. Our CVs may look different, and it may tell a different story of our professional accomplishments. And this is important for us to be reflective of this. And then, or maybe you might identify some gaps, or you might identify some opportunities, just looking at your own CV. And this is all valuable. Then we all have to be aspirational. Two things now: we should always aspire to do bigger and greater things in life, and we should always continue to grow. And I think these are two important things in anybody's professional career. And as these things happen, then we should tailor our CV to reflect on our next step. Okay. And it's important. Be purposeful. And I think a good example is, we have RAs come and talk to me about research projects. And I would tell them, look, my area of interest is prostate cancer, and I'm happy to help out with it. But if you want to work on other areas, I'm supportive of it, but I'm not the expert. I don't know the literature. Prostate cancer I know reasonably well. Some of the other oncology topics, maybe, but once it gets outside the realm of oncology, I'm not sure I'm the best guy to even mentor them, because I'm not following the literature as well. And the reason I'm saying this is because as you build your CV, be purposeful. You want to be recognized for something in your CV, and do everything and you can that recognition will come out. It'll be very clear to people. So be purposeful. And then off late, I have been including narratives, summaries, and highlights, because sometimes when your CVs get long, and it's very hard for somebody going through this to really understand the theme or why. And you can help the reviewer understand what this is all about. So I think it's reasonable to have an executive summary. It's a reasonable thing to have a narrative. What have you contributed to science, or highlight of your CV. I'm an extremely busy practitioner. I'm regionally known, and I've done 1,000 of these cases. Whatever your highlight is, as a surgeon, as a doctor, as an academician, feel free to do so. And every now and then, see whether your CV works, not necessarily because you're looking for another job. When you have a CV, just send it off. See what response you get. It's a validation. And that's not a bad thing. My philosophy in looking for new jobs is the only good things will come out of it. You look for a new job, you get a better position, it's good for you and your family, we are happy for you. Or you can come back and say, you know what, I've looked around there, this is great where I am, and you're happier in your job. Okay, so it's not a bad thing. It also allows you to check your own market value, and from a CV point of view, it checks out how well your CV works, and that's not an unreasonable thing to do. And avoid jazz. We really don't want anything flowery. You work hard, do what you have to do. The CV will then speak for itself. Okay, and these are the tools. Again, please start with building a structure, stay current, update at every opportunity, review and reflect, tailor it, be purposeful. It's okay to include narrative summaries and highlights. Every now and then, check the impact of your CV. Any questions on this tool methodology? Okay, now I'm going to switch to a sample. So just make sure that I don't invade anybody's privacy. I have used my CV as an example. Again, it's nothing I'm not trying to show my CV to others, but I just want to show you guys the structure, and also go through some of the points that we already made. So the best way to do that, I thought that the best way to do it is, okay. Can you guys see both the PowerPoint and the PDF file on my screen?
Yes.
Yeah, thank you. Okay. So the first is the structure. Okay, so we have and I went when your CV gets long, and it's impossible to navigate. So you want to have a table of content, and this particular CV. I went up with started with a narrative. It says a CV and it gives an executive summary of what it is. Somebody doesn't have the time, quickly want to know you, then you write an executive summary. And the key thing here is what is your most recent job and what have you accomplished in a job? That's what people are interested in. History is important, but are we looking at a person who is on an upswing or who is plateauing down or on a downswing? We want to hire people who are on an upswing. Plateau is okay, but that's not the best for a growing department. I'm always looking for people. What have you done the 5 years? And tell me how we are done. And if you're on an upswing, you're going to be a part of my team. And those are the most competitive people. Okay. And so your executive summary can help you to do that. And then in here, I do have a one-page resume, and it's just very concise what we do. But what I really want to focus on is the structure of the curriculum vitae. And again, there are so many things that we can. And there are different types of structures. Each of you have to review a variety of formats and figure out what works well for you. As both Dr. Costa and Dr. Bandit got promoted in our department in the last few years. And I've had the pleasure of reviewing their promotion package and so on, and working with them. And then so this and other promotion packages I worked on, they like this kind of a structure. And a lot of the structure that you see here is what goes into a promotion package. And these packages are long. There are something could be more than 100 pages, some of them over 200 pages. So these are very long. And then the CV consists of all these categories. So the first thing is your biographical information. Now, whether you want to use your date of birth, your gender, your pronouns, and so on, it's entirely up to you. There are some curriculum vitae that also mentions about marriage, children, and so on. And I think those are all optional. I don't think any of them can hurt you. I prefer not to include them on my curriculum vitae because I don't want this to bias in one way or the other. That's just my choice. But I see a lot of people that will include that kind of information, and that's perfectly all right. And that's, again, a decision you need to make for yourself. And then you want to put your education, training, and licenses and have an order to it. Because once your biography, your job, your medical school residency fellowship, your licenses, board certification, and so on. And then when you go into the next thing is your appointments. Even as a resident, I think these are your appointments because these are professional appointments. If you're just graduating from your residency, state that you were an intern, state that you were a urology resident, and the last year you were a chief resident. And those are important appointments because each of these have a different role to play, and you have evolved over time, and you need to include those in your appointments. You don't necessarily have to call them academic appointments. I mean, this is an academic CV, so it's a little bit different, but it's important that you do include your appointments. And if you had any additional roles, so for example, you served on the institutional GME committee and you represent the other residents, that's important to note too. So you can include all those in your appointments. And then honors and awards. Our residents in the last 4 years have consistently won the Montague Award at the Southeastern AUA. And you're part of these awards, and you have to include them in your CV. And any other awards you could have gotten when you were in medical school or even earlier, in high school. There's nothing wrong. I would include all of those honors and awards that you have secured over time. Okay, again, you maintain a list of all this, and you have to try and update them as you move forward, as you get new awards, new recognitions, anything you get. This is your chance to tell the world about your accomplishments. And if there are any noises about you out there, hopefully those noises will be drowned because your CV is so strong and speaks for yourself. Then the other thing is service. So you're all a member of the American Urological Association. You are members of the Southeastern AUA. You are resident members of the Florida Urologic Society. And all these memberships should be in your CV because remember, not everybody can get a membership. You need to meet certain qualifications and requirements to become a member of a particular society. And if you're a member of that society, that validates you, that you're a resident in good standing and you are able to get a membership of the Southeastern AUA or AUA. And these are very important. The other thing is any committees you serve on. For our residents, for example, our Euro 2 moderate journal clubs. And I would include that in your CV that as a Euro 2, you are moderator of a journal club. I think that's an important role to play. And you're already doing a hard work. You're thinking about journal club a month in advance. You're working with your attendings and other residents. Getting the articles together, you're communicating with your team the articles, and at the end of the day, you're moderating the session. This is a lot of leadership and planning and organization that goes into it, and that should go on your CV because then it tells me this person comes to my department as a faculty, then has already got this kind of leadership experience. He's able to work with other people. You're a chief resident and you're running the QI conference for the department, then just say you're the moderator for the QI conference for our department. And this may sound like a small thing, but over a period of time, these things really add up and it's important. And you include it every time you go. And this is what I refer to, trying to do this at every opportunity. So as you complete your Euro 2 and you moderated the journal club, you conducted it, that should have gone on your CV. Now you become Euro 3. Now you're doing interesting cases for the department. That should go on your CV. Now you're a chief resident doing QI. That should go on your CV right away. And there's a date to it, 2025 to 2026. And it's very important you put all these things in because this will help you in the future. And the other thing is we all get requests to review articles for journals. And this again speaks to your credibility. Not everybody gets an invitation. And when you get an invitation, please accept it. And it'll take you 2 hours or so to do the work. It tells a few things. First is people around you find you credible, that they're inviting you to review articles for the journals, which I think is is by itself is credible. And the fact you have taken time to do that shows that you are very service oriented and you are providing service to the community. And we're all busy, but despite that, we have taken a couple of hours. And I tell this to our residents and RAs we publish. Sometimes we get favorable reviews, sometimes we get challenging reviews. But I'm always grateful for the reviewers to have taken time and reviewed it, irrespective of what they felt about our manuscript. So this is important, and you should be adding this to your CV. And any other extramural activities. For example, you may be doing some community activities. You may be involved in a 5K run, raising funds for a cause. And those are the kind of things you want to add on your CV as well, because it just reflects that your life is more holistic and you're really going out of the way to engage with the community and then so on with what you do. Okay, I will pause here for a moment, see whether you guys have any questions on any of these categories, and we'll move on to the other categories in a moment. Okay. And then as your CV becomes longer and diverse and all that, sometimes it's very hard for a reviewer to follow. So you might want to include some narratives, what have you done and why are you doing what you do and so on. And so here, I put some contributions because I work on the clinical arena and on basic science and all that. And sometimes looking at my CV can be difficult for somebody to discern this guy a researcher, doctor? Does he see patients? Does he do this and that? So it's kind of hard. So you might want to narrate it. And again, this is your call. This is your CV. You do the way you want, and that way you're able to compete. And there's no one way to do it. There are varieties of ways to do it, and you just have to decide on a structure. So the first thing you need to do, you have to be committed to building a competitive CV. You're going to build a structure, and whatever structure you prefer, and then you stay current and update it at every opportunity. Okay. Now we'll go to some of the other areas that we talk about that Mo was referring to. So on so most of you guys, by the time you graduate, will have several publications, okay? And a lot of you have several publications even before you started your residency program. So you guys are a very competitive group, okay? And so now, how do you list your publications? Generally, start with your articles. And then anything that's comprehensive, such as articles, if you write textbooks, either you are an editor of a textbook or you have a chapter in a textbook, include that. If you have reviewed any books and things like that for others. And then you come with abstracts, because abstracts are of value, but in terms of the biggest value or the full-length manuscripts that you have published, becomes very important. So you write that in that order. And these days now, we have abstracts, we have video abstracts, and now we have podcasts. So I've seen one CV who came for a chair position, and the number of publications were reasonable. But what was very impressive was this guy was was a podcaster and used to podcast on one topic almost every other week, and he did that for a couple of years. And he had a long list of podcasts that were available. And so with or now with social media platforms, there are a variety of other kind of displays we can do. So you can include any or all of those, because communication can happen in so many ways, and there are so many opportunities. So the CVs of the future will probably look a little bit different from more conventional CVs that we see today. So if you're a podcaster, if you have some postings, some magazine articles, and whatever that might be, feel free to include all that in your publications. And then I'm just going to quickly go through what Mo asked and say, what are the kind of information you want to include? And then just going to skip to publications now. And so what it is, we talked about verification. Okay, so the first thing is Google Scholar. All of you have a Google Scholar account. Okay, you may or may not know this, but if you Google your name and go into Google, everybody has a Google Scholar account. And what you might want to do is to look at your citations. So the Google Scholar will tell you what your number of citations that are out there, what your H index is. H index is the number of articles that are cited as number of times. So if you have, say, 20 articles that, say you have about 50 publications, and 20 of those articles have been cited at least 20 times, the H index is 20. And depending on years you have been out of your training and you continue to publish, anything around 20 is good. I think that's a good number. If you hit 40, then that becomes outstanding, and anything more than 60 is exceptional. We have one faculty here at UF whose H index is 119. So, truly exceptional. But also citations depend on the field you're in. For example, oncology and things, you tend to have a higher citation than in, say, a field of mathematics, because it's not as widely cited. And even within the citations, if you write a methodology paper or some form of demographics paper, that gets cited more than something very discrete or very scientific that only gets cited a few times. And for me, I wrote a paper on kidney cancer incidence about 20 years ago and gets cited a lot, but that's a demographics paper. There's nothing new, but nevertheless, that gets cited. Again, all these things have to be taken with a grain of salt just to understand the index. And then make sure this is verifiable. So when you go into your Google Scholar page, you can just copy the URL and paste it here. So if somebody is interested, they can go ahead and click on it, and then that will take them to the page. So this is the point I was trying to make, where it's verifiable. And then You can also put in some QR codes. If somebody, these days QR code is everywhere, they can point a camera at it and then they can quickly land on this page if they don't want to click on it. And then in the PubMed, when you go, it gives you graphs not similar, something like this. You want to, it gives you the number of publications you had over the years, and it also gives you where you can generate some of these trend lines. And what you're really doing to the reviewer is, here I am sending you the CV. I'm on an upswing here. I'm publishing a lot, and then consider me for that role that I'm interested in. Consider me for that position. And I'm going to, and this is what people want to see. They want to see somebody in an upswing. If I see this and this is a straight line or trending down, that's okay. That there is a different role for that person. But if I'm looking for somebody for leadership, then I want somebody who want to lead, because it takes a lot of energy and time, and we want people on the upswing. And you can look at it yourself at one point and say, look, I was on an upswing, now I'm trending down. Maybe I should be applying for leadership position, or maybe I shouldn't be in a leadership position, because these positions call for a lot of energy and time. And it's a good way to reflect on ourselves. And you don't have to be going up and up. Life, sometimes in life, contentment is good, and you accomplished enough. And it's maybe there are other things we can do. But nevertheless, these are just good examples of how you can do your CV. The other important thing for you guys is you can create what we call a public bibliography. What this is, you can go into PubMed and it will give you, under your name, you can create a bibliography for yourself. And then this is very credible. You can make this bibliography public. And so you can then copy that URL and put it on your CV. What this does is somebody, because some names are very common, and so if you Google, if you search with that person's name, you get 5,000 articles, okay? It's very hard to know. It may not be very specific to your name. So if somebody is interested and they say, look, I'm interested in this position, I would like to focus on this area, my response is, okay, I'm happy to let you focus. Let me quickly verify your track record in this area. And then if that corroborates your interest, then you're in. Okay. I mean, if it doesn't corroborate, doesn't mean you're not in. We just need to support you, because if you have aspirations, we'll support you. So this is another thing you guys can generate. You can go in and create your own bibliography and put it on your CV. It really allows you to verify what you're doing. Any questions so far on how to list your publications? Okay. Next thing I want to talk about is presentations. Okay. Now, you as residents do a lot of presentation, even in your residency program. Okay. Now, make sure you make a note of it and enter it on your CV, because you're giving 2 or 3 presentations every year. And by the time you graduate, you would have given 10 to 15 presentations, and that should go on your CV, because this is truly an invited presentation. You're invited to the grand rounds and you're speaking to the entire group. And then you have spent all the time and effort in putting the talk together. Then you can put that in your invited speaker list. Okay, the talks you're given. That also tells us something. If I'm reviewing an application and this person has been invited and then has been able to give talks, that tells me about the oral communication skills, presentation skills. And I know this person has rehearsed it. They have agreed to give a presentation. They have taken time to put a presentation together, and they've done the presentation. And remember, these are the things we're looking for in a team player. Who would take responsibility? Not somebody who says, oh God, I got to do one more now. No, if you give me an opportunity, let me do it. That we want, and your CV should be able to tell the reviewer that, and that's what you're trying to do. And as residents, you guys are already doing it. So if you haven't done it already, please go back this week and remember all the talks you gave in the last few years and put it on your CV. This is so important. And then the other thing is, we all get invited for a variety of media presentations, it could be radio, TV, social media, whatever. Make a note of it. And these things are verifiable. If you have been on a local TV station, interviewed on something, or a radio station, which most of you will do as you go into your career in a news reporters. Why there might be an important person with a new diagnosis, and they might want to talk to somebody who's an expert or familiar with the diagnosis and may reach out to you at a short notice. Usually these things turn around in less than 24 hours. And then if you're available, take advantage of it. That's your way to relate to the community. You get known in the community. And then, of course, you get it on your CV. Okay. And we got about 5 minutes left. So I'll quickly go through teaching activities. And this is a very important aspect in academia and how we teach and so on. And then as residents, you guys are already teaching each other. So, or you teach medical students. And then if you had an opportunity to work with students or otherwise, anything that you teach, put that on your CV as well. And it's important. And what happens is over a period of time, your CV is what it is now. Now, 5 years from now, 10 years from now, you may look at this and say, you know what, I think these are a little bit old, or maybe in midst of what I have on my CV now, this is not as important now. So you may choose to delete it down the road, but it's very, very important that you put it right now. Okay, so that you update it. And then if you have any of your mentees who won awards and things like that, as you move forward in your career, you'll be doing it. If you do any courses, and I say, for example, we do a course here say, for example, you have a guy from Eurolift come in and teach us how to do a Eurolift, and then you organized it. Then you can put yourself as a course organizer because you took the initiative to talk to the vendor. You took the initiative to bring the vendor in, and you taught your fellow residents how to do Eurolift technique. It's important, and I think to be able to show that you're thinking in terms of teaching and training others, it's a very valuable skill set, and it'll impress a lot of people. As a resident, this guy was, and imagine on your CV, you have, by the time you graduate, you have 6 or 7 courses you organized, and which you guys do anyway. You just need to list it. And that tells me now, if I'm looking for a young resident or a fellow to join my program, they're already engaged in teaching, that will engender confidence. And now you're published, your CV is very organized. I can follow what you have done. There are no gaps. Every year you have been doing something, publishing a couple of papers, writing some abstracts, doing some teaching activities, doing grand round presentations, and you're consistently active. And in my mind, you are the guy on that upswing. I want you on my team. I want you in this job. Okay. That way you'll beat your competition. And that's what you do. And you don't need to do anything special. Just be mindful. Create this structure. And so I might run that right now. Okay. Okay, so this is the conclusion slide. This is all I want you guys to do right now. If you haven't, you're probably doing this already, but if you haven't, or if you have been doing that, but not with the same consistency, this is your time. You start building it, because you never know what the next opportunity is going to knock on the door, and you should be ready. Okay, if somebody calls in and say, I got a great job for you, or in your own mind, something opens up in your organization and you think you are qualified to do it, or you want to do it, then you're ready. Your CV is not holding you back. Okay. And I just want you guys to reflect on this tool set that here. And I recorded this talk. We'll put it on our server if any of you guys want to look back in the future, and we'll take it from there. Okay. So I'll stop here, and I'm happy to take any questions. Okay, if none else, we'll stop. You guys have a wonderful week. Thank you.
Thank you.
Thank you, Tetra Balaji.
Thank you.
Oh, thank you.